I want you to pay attention, because what's been surfaced and floating around in LinkedIn and social platforms in the general public is that the federal policy discussions that isn't a small bureaucratic adjustment. It's a strategic strike against the nursing profession and their future. Right now, there is a rule from the U.S. Department of Education that could be removing the nursing from the official classification of professional degree programs. If that classification disappears, the consequences are immediate and very measurable. Graduate nursing students could see federal loan limits slashed to about $20,500 per year, and lifetime borrowing for advanced nursing education could drop from roughly $138,500 to around $57,500. That is not a minor financial inconvenience. That is a pipeline chokehold. And pipelines control the future. Nurse practitioner programs, clinical nurse specialists, nurse anesthetists, nurse educators, the next generation of healthcare leadership. All of them rely on graduate education. So here's the truth that you know most people are not willing to say because they are too polite. Healthcare systems across America are already screaming about clinician shortages. Hospitals cannot fill positions. Primary care deserts are expanding, and rural communities are running out of providers. Yet at the exact same time, a policy proposal emerges that could make it dramatically harder for nurses to obtain advanced degrees. That is not just a policy issue. That is a strategic contradiction. And if we are being brutally honest, the healthcare system has always walked a strange line when it comes to nursing. Depend on nurses, lean on nurses, build entire systems on the backs of nurses, but hesitate every step of the way to fully recognize nursing as a professional authority equal to other clinical disciplines. That tension has existed for decades. Now it is surfacing again in federal policy language. Because when funding structures change, power structures change. And make no mistake, this decision does not just affect nursing students. It affects every healthcare leader planning the workforce of the future: hospitals, universities, healthcare systems, public health agencies. If fewer nurses can afford graduate education, fewer clinicians will exist to fill the roles healthcare desperately needs. Primary care providers, specialty clinicians, educators training the next generation. That is the reality of workforce mathematics. But here is where leadership begins. This moment isn't just about exposure. It's about response. Public comment periods exist for a reason. Policy leaders watch professional voices. And when healthcare professionals stay silent, decisions get made without them. LinkedIn is not just a networking platform. It is where healthcare executives, educators, policymakers, and clinicians gather to shape the future of the workforce. So the question isn't whether this proposal matters, because it does. The real question is whether the profession that holds the largest portion of healthcare workforce will stand up and defend its professional status. Because the battlefield for the future of healthcare isn't always inside the hospital. Sometimes it's inside policy rooms, regulatory language, and financial structures. And if nurses want a seat at the strategic table, they must speak like professionals who already belong there. The future of nursing workforce isn't just debated. It's being written right now.